Hi, everybody. This is Dr. Michael Hirsch, Chief Information Officer for the pandemic for the City of Worcester and Medical Director for the Division of Public Health for the City of Worcester. And it's great to be back with you for another public information session with our friends at the Senior Center. People for centuries have referred to May as the merry month of May, because I guess the flowers bloomed and it felt really like you were making that transition out of dark winter. And I think 2021 is going to be remembered as one of the merriest months ever, because as I'm speaking to you here, and hopefully you'll be listening to me soon after we record this, we've gotten a tremendous amount of good news about where we are in the pandemic. And, that's kind of my mission today, is always to kind of keep you up to date with what's the latest, what's the greatest in pandemic response and where we're going. I wish I could be a lot more definitive of what I'm telling you today, because there's a lot of moving pieces right now. We just kind of got information yesterday that things were going to be opening up big time on May 29th, which is just 2 weeks away. And that is a very surprising, delightful, and a little bit scary proposition for those of us in public health, and certainly in all aspects of municipal government. We're all kind of standing around doing meetings now, saying, how are we going to do this safely? What's the best way of doing this? We can't just undo everything that we have done to mitigate the spread of the COVID-19 virus in a day. So we have a lot of work to do, but it's great to be in this position. Now, last month when I talked to you, I think we were just at that plateau thing where we just didn't know where was it going to go. Were we going to see a big bump after the Easter holiday? Were we going to see that after the April vacations that there was going to be a lot more of a surge? The answer is no. And why do you think that was? Well, the answer, I think, is vaccination. Vaccinations have been proceeding beautifully, aggressively all over the country. And certainly here in the Commonwealth, we have just about 63% of the Commonwealth has had at least one dose of the vaccine, and about 48% is totally vaccinated. So almost half totally vaccinated, and almost 2/3 partially vaccinated. And that means the virus, even with these variants that we were talking about, remember we were talking about there was a London variant, a South African variant, a Brazilian variant. Now, unfortunately, there's a very devastating Indian variant that is going through that country and causing some terrible, terrible outbreaks there. Those variants have been here, but there just have not been enough unvaccinated people for them to take off in the same way as they have in India. And so we're finding the case numbers daily are going way, way down. We're down about 50% of the case numbers that we were seeing even 2 weeks ago. Whereas at its height, for example, the medical center at UMass was seeing about 240 patients in their system on a daily basis. Right now, there are only about 12 to 15 on a daily basis. So it's not completely gone. It's here probably to stay to some degree, but the vaccinations have really beaten down the likelihood of a big outbreak now. And additionally, we know that vaccinated people, even if they do get a breakthrough infection, they don't get as sick. They don't need the ICU. They don't need to, be hospitalized for days and days and days. So that's the main message that I'm giving you. I think most of the seniors in our region, and we know this by the numbers, about 94% of you have been vaccinated, which is fantastic, because you as seniors, and I'm talking about 60 and above, were our most vulnerable population during the first surge in 2020. Then in the second surge, because we got a lot smarter about how to take care of the seniors that were in skilled nursing facilities and also in the hospital if they got hospitalized, we didn't see quite the numbers of seniors getting sick that second surge. Now in the what was the kind of the mini blip that we had from mid-March to April, most of the seniors were vaccinated because the vaccinations started in January, and we just didn't see that kind of wildfire effect like we did at the Old Soldiers Home in Holyoke. So thank you all for cooperating with the vaccination program and for stepping up. And thank you also for doing, I think, a lot of the advocacy in your families to your younger relatives, whether it's daughters, sons, grandkids, nieces, nephews, who might have been more resistant to getting the vaccination. I think you're pitching that it did them good, did yourself good, really helped us to get those numbers up as well. So we have a pretty high rate of vaccination right now in all the age groups, with the exception of the, I would say, 15 to 30-year-olds. Some of it is because it wasn't as recent. It was only recently, I should say, that the 12 to 20-year-olds were eligible for vaccination. Now they are, and we're seeing a lot of parents bring in their 12 to 15-year-olds and their 16 to 18-year-olds, and that's great because that's going to help us ensure that when the new school year starts in September, that we're going to have a much safer school system that will not have to go through all of the different distancing and limitations as far as class size goes. But that other group, that 20 to 30 group, we used to call those folks the invincibles. They didn't think they could ever get sick. They just believed that, you know, it's going to not be a serious case of COVID if they get it. That might be true. They seem to have a very good immune system. They don't seem to get hospitalized nearly as much. There have been exceptions. We've seen some very young people with very, very bad illness. We've also seen a number of the young people that got this infection back in the spring of 2020 coming back now with chronic ailments. This is what they call the long hauler effect. And that's what we don't know, we can't predict. So we're still saying it's much better to get herd immunity from a vaccination than it is from getting the virus and seeing how much immunity you get from that. Because the immunity you get from the virus, if you catch COVID-19, may be actually something that doesn't turn off. The immunity seems to rev up and can cause longer-term damage to whatever organ that virus settled in. Lungs, you might get chronic cough, shortness of breath, less exercise tolerance. Heart, you might get sluggishness of how the heart pumps. Brain, you might have some confusion. Lower extremities, you might have some leg weakness. Nerve systems, you might have needles and pins or kind of a feeling of loss of sensation of your soles of your feet, and loss of sense of smell, loss of taste. That can stay with you for a while. So we don't want people to get COVID. And it looks like the vaccination has really helped push us over the edge. So Governor Baker, after hearing last week that the CDC was removing a lot of restrictions on when and where you can wear your masks, decided to announce that May 29th we're going to open up and COVID restrictions will go away. But I will tell you there's some definite exceptions, and we have to all know this, okay? If you go on a plane, if you go on a train, if you go in a bus, if you go into a nursing home, if you go into a hospital, if you go into a congregant living facility like a sober home or a halfway house or a homeless shelter, you still should wear your mask because it is a less stable environment, less secure in the knowledge that no one there has the disease. That's an area where you have confinement, close quarters, you're not distanced. Those are the kind of places where you have to wear your mask. But outdoors, if you're vaccinated, you don't have to wear your mask. If you're with your group of relatives and you're all vaccinated, you don't have to wear your mask indoors or outdoors. You can hug your grandchildren even though they're not vaccinated. That's okay. There's very little evidence of transmission of the disease from young kids to their grandparents. There is some evidence of transmission in school settings from student to teacher, but the vaccination has made that much, much less because a lot of those stats were being compiled when the teachers weren't vaccinated. So a couple of conclusions you can reach from that. The masks helped us get through the first 8-9 months of the pandemic. We all have to recognize that. We could have had a much, much worse outcome if the folks in the Commonwealth of Massachusetts had not been so compliant with mask wearing. The second part of these first 15 months of the pandemic, we owe a lot of our success to the vaccine. And the vaccine has now freed us from having to wear the mask. Masking outside, if you're vaccinated, you don't need to do it anymore. The exception of that would be if you decide that you're going to go to an outdoor, either sporting event, concert, where you're wall-to-wall people, and you don't know how many of the people there are vaccinated, because I don't think, as much as probably public health officials like me would like to see this, where you have to show your vaccination status before you go into a crowd like that, that's not going to happen. It's thought to be kind of a violation of your civil rights. Personally, I think people should be proud to show that they're vaccinated. But anyway, if you go into that kind of a situation that I described, really close quarters where you're not sure who's vaccinated, who's not, particularly you as a senior, don't go without a mask. So don't burn your mask. Don't have a mask burning party. Keep that mask handy, because you never know when you're going to be in a situation that you don't feel comfortable that everybody around you has been as compliant as you about keeping COVID away from your family. But I think that on the whole, when Governor Baker says May 29th, no more restrictions, I mean, think about this. Our brand new Polar Park is going to have 100% capacity. They've been having their first few games at 25% capacity. That's a big change. And we're going to see a lot more challenges there. The big box stores, the restaurants, the spacing is all going to go away. So if you decide, well, now you want to go out again with your family to celebrate, you're going to find that there's going to be tables to your left and tables to your right, and no one's wearing a mask. And if you feel uncomfortable in that situation, nothing wrong with wearing your mask. So we don't want to see mask shaming going on where people are challenging, why are you wearing a mask? It may very well be, as we move forward, that the CDC comes up with guidelines that would suggest that perhaps in the winter we all wear masks. When we were wearing masks this winter to protect us from COVID, it did protect us from COVID, but it also stopped the normal flu epidemics that we had this winter. We had almost no flu because of the masks. And in Asia, where they've gone through several of these outbreaks before, like SARS, this is called SARS-2, right? This COVID-19 also has the name of SARS-2. They had a SARS-1 outbreak, and that convinced a lot of the people in China and Japan to wear masks on subway trains and in crowded conditions on the street. That may be the new normal. I don't know yet. We're all kind of learning as we go. And in that learning process, you all should be aware of this fact. There will be some outbreaks. There will be some clusters. We may find that there's going to be a new variant that comes to town that reverses some of this. Good news. I think that's something that we have to grow to live with. We have to learn to live with this virus. It's probably not ever going to go away. You can't put the genie back in the bottle. It's going to be here at a low level. Hopefully, we will have immunity from this first set of injections. And it may very well be that another development that will happen this coming winter is that a booster will be made either by Moderna or Pfizer or Johnson & Johnson or all three, that we have to take, if not on a yearly basis, on some scheduled recurrent basis based on the kind of species of virus that they are identifying. And a lot of these booster shots are going to be made with a particular angle of attacking the new variants, like the London variant in particular, over other forms of COVID. And I think that's going to be part of our new normal too. What shouldn't be a strain is making sure that you wash your hands frequently. That's a great disease preventative thing anyway. And having a handy dandy little hand sanitizer is a great idea. Keep it on you. It doesn't hurt. And we know that the surface transmission of COVID is not always what it was originally thought to be. So, in the beginning of the pandemic, we had people washing all their groceries when they came home from the supermarket. We know probably that's not a very important mode of spread now. But if you've been, sneezing, blowing your nose, shaking hands, I'm not sure if the handshake, by the way, is going to come back. I think the elbow bump may be here to stay. If you've been doing those kind of activities, have this handy and use it, and make sure that you reduce your viral load on your hands as regularly as you can. And I guess the other main tip I would say in this day and age is if you have symptoms like sniffles or the flu-like stuff, the aches and the cough and things like that, don't assume that because you were vaccinated that you can't have COVID. You still have to get testing. Testing is still going to be widely available. Contact tracing, if you test positive, will be a very important thing moving forward still in reducing the spread of this virus again. And if you have any of those symptoms that I mentioned, and don't make excuses because it's a lot of allergies this summer, pollen counts high, just get yourself tested. That's the way to do it. And if you test positive, or if you just had these symptoms and you're writing it off to, I always have a little stuffy nose in the morning and in the winter, in the summer, whenever it is, don't go to work or don't go to the senior center. Don't put other congregants wherever you would hang out at risk. Keep yourself a little bit isolated until you get your test back. And the tests now are going to be much more available. They're going to be stuff you can do right in the privacy of your home. You'll get a kit. It'll be very clearly instructed how you do it. And then you'll get your answer at home in like half an hour. Not a bad thing. And these are all things that have been worked on all through the pandemic, and now they're finally becoming widely available. So I guess the real good news is that we have weathered a tremendous storm. I think more than a storm, almost like a cyclone. And we're still standing. And the city has stood tall. You're going to start seeing wonderful activities out on the common again. You're going to start seeing people going all through the Canal District, walking around, enjoying the new venues around Polar Park. You're going to see just a renaissance again. We were just in the midst of a renaissance when this hit us in March of 2020, and now we're going to even exponentially experience a larger one. And I think, again, the public, you as seniors and as trusted elders in your respective homes, deserve a huge vote of thanks, certainly from me on behalf of the city and on behalf of the public health officials, because you helped us spread the word in the first half to wear your mask, do your 3 W's, wash your hands and watch your distance, and then in the second part of the pandemic to get those vaccinations done so that you could be together, hug your loved ones again, and now no restrictions. So things may change on the ground. I promise in the June session that we're going to do, we'll review this some more. I think it was interesting that today, as we're taping this, is the birthday of Edward Jenner. Any of you know who Edward Jenner is? I bet you do. Edward Jenner was a physician in England, and he was known as the father of vaccination and immunology. He took scrapings from cowpox that he saw cows suffering with and used it to fight off the dreaded smallpox virus. And by scratching a little boy, 8-year-old boy named Edward Phipps, with his cowpox concoction, he got Edward to fight off the smallpox, which was frequently deadly in 1796. So happy birthday to the father of vaccination, because that whole concept is the building block and the foundation of where we got COVID vaccine that worked so great that now we are here about to open up our beautiful city again. And you all know as seniors that everything that has new and fancy releases and fanfare when it comes out to the public, it's built on the building blocks from years ago. That's how your family works. Everything that anyone in your family achieves in the younger generations does it on your back. And that's how life is. And I'm so grateful that you spend a little time with me every month. And I hope that we all see this through and have a wonderful summer together. So this is Mike Hirsch, and I'll be signing off now. Please be safe. Continue to be model citizens. The Senior Center will be opening up soon, and you'll have your favorite hangout again. And God bless you all. Thank you.